Good afternoon, folks. Welcome.
Hello, everyone.
Hello and welcome.
We'll just give a few minutes for folks to continue to join us, and then we'll begin. Good afternoon, everyone. Thank you for joining us. We'll start in about 3 minutes. Good afternoon. Thank you for joining us. We'll start in about 3 minutes. Hope everyone's enjoying this sunny afternoon. Ramadan Mubarak for those who are fasting. Okay. Well, as folks join in, we'll start. So welcome everyone to our 4th COVID vaccine Q&A forum hosted by Health Access Thorncliffe Park, Flemington Health Center, and the Neighborhood Organization. As we begin, I just would like to acknowledge the land. We acknowledge that the land on which we gather and work is situated upon traditional territories. These lands were originally the homes of the Wendat, the Anishebek, the Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nations, and continue to be. Today, the meeting place of Toronto is still the home of many Indigenous peoples from across Turtle Island, Canada. And we are grateful to have the opportunity to work in the community on this territory. We recognize that many of the barriers faced by newcomers in their settlement on this territory continues to be faced by Indigenous peoples across this land. We make this acknowledgement because we are committed to anti-oppression, anti-racism, and equity in all aspects of our work. So thank you again. Thank you for joining us. My name is Amira, and I am a community health worker with Health Access Thorncliffe Park. And I'm going to pass it over to my co-moderators to also introduce themselves. So Iman, if you could introduce yourself.
Thanks, Amira. Good afternoon, everyone. My name is Iman Khan, and I'm the Events and Communication Specialist with the Flemington Health Center. The focus of my work is providing support with community outreach, engagement, and programming for East Toronto neighborhoods, particularly within South Asian populations. I'm very excited to be your co-moderator for today, and I look forward to speaking with you further.
Perfect. And I'm also going to allow my colleague Munira, if you could introduce yourself.
Good afternoon. Assalamu alaikum, everybody. My name is Munira, and I'm on the community engagement team at Health Access Thorncliffe Park. And Ramadan Mubarak to everybody.
Perfect. Thank you so much. So along with my lovely co-moderators, we have an esteemed panelist joining us this month. I'm going to get them to introduce themselves in one moment, but just as we proceed, just a couple housekeeping rules. So again, we are streaming live on Facebook. So we will, so that folks can tag themselves or share on their personal page. We will be asking our panelists pre-submitted questions that have been sent in prior to today's session. However, we do have the Q&A box where folks can type their questions, and we will have a time to answer the live questions. So if you do have a question, please put it in the Q&A box. I know sometimes we get mixed up with the chat and the Q&A, but the Q&A, that way we ensure for sure that we can take a look at it. We may have someone type their response, or we may answer it live. After our pre-submitted questions, as I mentioned, we'll go to our live Q&A. We'll have a little bit of a story sharing with one of our community health ambassadors, and then we'll also do some resource sharing. So with that, I'm going to ask my esteemed panelists to introduce themselves. So I'm going to start with Dr. John Ihnat.
Thank you, Amira, and thank you to you and Iman and Munira for organizing this. It's really a pleasure to be part of today, and it's actually very exciting for me to have met today my colleagues, Dr. Syed and Ms. Mahmoudi. It's really a pleasure, and Ramadan Mubarak to everyone. So my name is Dr. John Ihnat. I'm a family doctor at Health Access Thorncliffe Park. And my particular interests in medicine are in global health, essentially trying to narrow the gap in health internationally, and also in how best to serve newcomers to Canada. So I teach global health at the University of Toronto's medical school. And so I'm not really an expert on vaccines or COVID, but what I am willing to do is share from my experience and what I've learned, part of what we're all learning in this kind of new environment of the coronavirus and vaccines. I've been asked to just mention briefly some of the things I've been experiencing in my clinic, and really to summarize, I'd say certainly I'm seeing COVID. I'm seeing people facing respiratory effects of COVID. But regarding the vaccines particularly, because today's about the vaccines, I'm seeing that people really are falling into three categories. I see people that, one group of people that are really interested in the vaccine. They can't wait to get the vaccine. They want to find out how soon they can get it. I see another group of people that are puzzled really by all the talk about the vaccines and blood clots and what are the side effects and different ages and things changing, and that they have a lot of questions. And then I see a third group of people who are actually afraid of the vaccines and are very, very concerned about what the vaccines may do. So whichever group you're part of today, I'm really happy that you're here, and I hope that we can answer some or all of your questions. So I'm looking forward to today.
Perfect. Thank you so much, Dr. Ihnat. I'm going to pass it over to Raha Mahmoudi.
Hello, everybody. My name is Raha Mahmoudi. Thank you so much, Amira, Munira, and Iman for having me join today. And I look forward to be able to share my experience. I am one of the community health ambassadors with Health Access Thorncliffe Park. And outside of that role, I am a Master of Public Health student at McMaster University. I'm interested in health equity, and I definitely echo what Dr. John has said in terms of what he's seeing in terms of COVID. I am definitely hearing from the community as well. Those that are a little timid about getting the vaccine and have a lot of questions about the consequences of it, but also those that are ready and a little confused about how to move forward and book those appointments and how to get them as well. So I'll leave it there, and I look forward to sharing a bit of my experience.
Great, thank you, Raha. And Dr. Syed, if you could introduce yourself.
So, hello, assalamu alaikum, Ramadan Mubarak to everybody. I'm Dr. Ikram Syed. I actually grew up in Thorncliffe. I was born in Chicago, but then we came to Toronto when I was very young. And my whole family, my brother, my sisters, myself, all went to school in the Thorncliffe area, to Valley Park, to Garno, and then to U of T. So, you know, I'm very thankful to everyone for having put this together and allowing me to be a part of, you know, being a group of people who are concerned and trying to, share information with our community there and our whole community across Canada, basically, right? I practice now in Brampton, in Peel region. And as I'm sure many of you have seen, COVID is going full force here. And it's a challenge. And as my esteemed colleagues have mentioned, we find people in very different phases of their understanding, their acceptance, reluctance, or their desire to move forward. So, you know, these type of conferences, conversations, seminars, information sessions are hopefully a means to share and have a dialogue with each other, through which somebody may say, hey, you know what? I didn't think of that, or I didn't see that this way, or hey, this makes me think about something further. I've got a question to ask. So, you know, we're at a critical time, as we know. The next few weeks, next few months maybe, are going to be a clear indication of how we're doing. So the push is now, and hopefully we'll be able to share some details and some conversation and get some thoughts going here. So thank you again for putting this together.
Perfect. Thank you, Dr. Syed. I'm going to pass it over to Iman, and we're going to start with our pre-submitted questions.
Thank you, Amira. So I'm going to start with you, Dr. Ihnat. We've been hearing a lot about the AstraZeneca vaccine, and we continue to hear about blood clots with this particular vaccine. Can you please clarify what the efficacy of this vaccine is? How safe is it for folks to use?
Right. Thank you for that question, and thank you for whoever asked that question, because certainly it's top of mind, I think, for so many people, and it's good that we get to talk about it today. Now, I actually heard two questions there, so I'll address both of them. One is the efficacy of the AstraZeneca vaccine, and the second one is about blood clots. So let's talk about the blood clots first, because I know that that's, again, top of mind to everybody. So what the blood clots that we see are from the AstraZeneca vaccine is a particular kind of syndrome called vaccine-induced immune thrombotic thrombocytopenia, which is a big, long phrase, difficult to say, but the words actually help it. Vaccine-induced means it's caused by the vaccine. Immune means that it's actually your own immune system that seems to predispose toward this condition. Thrombotic means that, again, it causes your platelets, the parts of your, those blood cells that cause normal clotting in the blood, as well as abnormal clotting at times. And thrombocytopenia, it actually means that those platelets get used up to form these clots so much that it actually causes you to be low in platelets. The particular kind of clots that are common with this syndrome are actually clots that happen in the brain, in a vein in the brain called the venous sinus. And there can actually be quite a high mortality when that happens. It's around 40% mortality. However, if it's caught early, it can be treated. That's to give you some background of what we're talking about and what the condition is that we're talking about. But you should know that this is a very, very, very rare complication. We're still gathering data. We have a lot of data from around the world, the UK and elsewhere, but we're still gathering data to really narrow down exactly what the incidence of this is. So the last that I heard as of Friday from a specialist at Mount Sinai Hospital is that the incidence rate goes anywhere from 1 in 25,000 to 1 in a million. And the numbers that are usually quoted right around now are around 1 in 100,000 to 1 in 250,000 doses. So that's considered actually a rare complication. So let's put this into context. Let's put these numbers into context. What does it mean to have something like, a 1 in 100,000 chance of something like this blood clot happening after getting the AstraZeneca vaccine? Well, when you think of the annual risk of mortality from a motor vehicle accident for Canadians, and I'm using 2018 data, it's not 1 in 100,000, it's around 5 in 100,000. So 5 times the risk. But I don't know about you, but when I hop into my car, I don't immediately think, I shouldn't be doing this. I shouldn't be driving to the mall because, I could be killed, right? Because we do kind of instinctively know that it's a low risk. and the risk of this blood clots are even lower. And then when you think about, any intervention that we do in medicine, any medication that you take, whether it's over the counter, whether it's Advil from the pharmacy, comes with a risk. It comes with the potential for a side effect. But often those side effects are so low that we often, they escape our immediate consciousness, right? To give you an example, the oral contraceptive pill for women also has a risk of blood clots. And that risk is probably about 90 times higher than that of the AstraZeneca vaccine. It's maybe around 90 in 100,000. So, even though those blood clots aren't typically the kind that go to the brain, they're less dangerous, certainly. But it's just to give you a sense of what the risks are and how to put those numbers into context. Even more importantly, I think, in our context, in Thorncliffe Park, in Toronto, in Ontario, and the world, is that COVID itself causes blood clots. It happens to be a virus that is thrombogenic. It means it itself causes blood clots. And there's a lot of COVID, I know in my community in Thorncliffe Park. And if you get COVID, your risk of a blood clot is actually 1 in 100. That's without hospitalization. That's without going to the hospital. 1 in 100. That's not 1 in 100,000. That's not 1 in 25,000. That's 1 in 100, your risk of a blood clot. Again, typically a different kind of blood clot than the one that goes to the brain, but it gives you a sense of that you're at risk if you do not have the vaccine. If you become COVID positive, your actual risk not only of a blood clot is 1 in 100, your risk of going to hospital is 1 in 100. And if you get hospitalized, we found that your risk of a blood clot in hospital is 1 in 5, right? That's 20% chance of having a blood clot in the hospital. So really what we're talking about always in medicine, whether it's medications, whether it's vaccines, it's always a risk-benefit balance. Essentially the risk of getting COVID versus this admittedly very small risk from the vaccine. So looking at the numbers, what it comes down to is that for those over 40, and that's what currently the eligibility is in Ontario for the AstraZeneca vaccine, it's clearly safer for people to get the vaccine. So really it's the right thing to do for your health. There's a great phrase that I like that people are using now, and that is, take the vaccine that's offered to you, whether it's Pfizer, whether it's Moderna, or whether it's AstraZeneca. Now, as for some questions that I have heard from people is what about people who already have a risk of blood clots? What about people who have already had a deep vein thrombosis or a pulmonary embolism, or they're at higher risk of blood clots? Well, there's actually no contraindication to the AstraZeneca vaccine because, as I mentioned to you earlier, the mechanism of the particular kinds of blood clots that are so famous now with this vaccine is an immune-mediated response, which is different from the kind of pathophysiology, the mechanism, the biological mechanism that causes blood clots in these other conditions. So you could have had a blood clot before in your past. I would still recommend you get the AstraZeneca vaccine if it's offered to you, because the blood clot that has potential with that vaccine operates by a very different mechanism. So what about pregnancy? What if you're on the birth control pill? No contraindication. Again, different mechanism. So that's just a little bit about blood clots. Essentially, it's putting that low risk into context with the relatively higher risk of getting of if you were to get the coronavirus, the COVID virus itself. Now, there was also, Iman, when you read that question, there was also the question about the effectiveness of the vaccine. And research has shown that actually AstraZeneca vaccine is very effective. So it's 76% effective against severe disease, such as hospitalization or death, after even just a single standard dose. So that's, of course, in studies. In the real world, it might be somewhere between 60 or 76%, something like that. But that's a remarkable benefit after just one dose of the vaccine, because really hospitalization, death, serious outcomes, that's what we're really trying to avoid. Getting the sniffles would not be such a problem if that's what we were facing, but that's not what we're facing. We're seeing people that are being hospitalized, that are in ICUs, that are being intubated with tubes down their throats. And our ICUs hitting capacity. So that's what we're trying to prevent. And this vaccine is very effective. It's also a great vaccine because we can produce lots of it quickly, and it doesn't need that kind of deep freeze that you've heard about with, for instance, the Pfizer vaccine. In clinical trials, after dose 2 of the AstraZeneca vaccine, it had 100% efficacy against severe disease. Again, in the real world, that's probably between 70 and 96%, but those are great odds, right? And I should just stress, by the way, that when you're getting these vaccines, that I hope you do, it doesn't mean that you can't get COVID, right? These numbers aren't, in the real world, they aren't 100% from stopping you from getting the virus itself. What we're talking about is stopping you from having the kind of bad effects that we care about, the hospitalization, the serious outcomes, the intubation, the ventilation, the death. So essentially, it doesn't mean you won't get COVID, it just means it's highly unlikely that you'll die from it. So I hope that answers the question.
Yeah, thank you. Thank you, Dr. Ihnat. That was very clear and elaborate. I have a couple of Gen Xers who got the AstraZeneca vaccine this weekend in my house, so we're all very excited. So I just had a couple of follow-up questions around the second dose. So if there is a scenario where we run out of the vaccine supply before people are able to get their second dose, what happens then? And why are we currently not able to get our second doses in at 4 weeks as recommended by the manufacturers?
Okay, so again, 2 questions. I should say that maybe I'll answer the second question first. Why can't we get the second dose as recommended in the product monograph, et cetera? Essentially, it's and maybe I'll talk a little bit more about this at one point, but essentially it's a balance of supply, that we don't have the supply to give everybody the second dose of the vaccine right away, because what we've decided to do as a society is give as many people as possible a first dose. Because of those numbers I described earlier, after a first dose, the protection against the outcomes that we care about is our loved ones being hospitalized or dying from this virus. The chances go way down when you have the vaccine, when you have 1 dose. And we have lots of data around that. And again, I'll describe that a little bit more in a moment, but that's essentially the short story, is that we have a limited supply, and we really do think that it's better for everyone in society if we vaccinate as many people with the first dose as possible. So, but regarding, what if we run out? What if we don't have a vaccine supply before people get their second doses? First of all, I think that that's unlikely, simply because we're getting a lot of vaccine coming in. Our Pfizer vaccine supply, for example, is going to double very soon. We've been currently getting about 350,000, 400,000 doses per week, but in 2 weeks, that's going to go up to about 800,000 doses per week. So what I'm hoping is that we're not going to face that situation where people won't be able to get their second dose. We should also just keep in mind that clinical trial data has shown that, for instance, the AstraZeneca vaccine, that delaying the second dose for greater than or equal to 12 weeks is actually more protective than a shorter time between doses. And that's, again, for symptomatic illnesses. So, so I wouldn't worry too much about delaying the dose. And we know that from other vaccines that, I give vaccines to children all the time. And what we've learned and what we know is that delaying a vaccine does not cause a problem with the immune response that occurs when the person does eventually get that second dose or that repeat dose. That that essentially with the first dose, your body is kind of like taught to recognize the virus. And when the reminder comes, when that second dose comes and reminds the body, by the way, you have to look out for this virus, the body's response is robust. So again, based on our experience with other vaccines, wouldn't be too concerned about a delayed second dose. And again, I just want to emphasize that single dose is important for again, what we care about, the dying and hospitalization. Do you remember, the disaster in long-term care that we saw last year, the terrible, terrible outcomes, heartbreaking outcomes? We don't hear about that now, right? And why is that? It's because of the success of the single dose, right? In Ontario, the daily risk of COVID in long-term care went down 70% after 21 days after the first dose of a vaccine. So in our frailest population, in the people whose immune systems are least likely to be robust and mount a response to the vaccine, the single dose was enormously successful in terms of bringing down those deaths and hospitalizations among our elderly. In long-term care in Quebec and in the UK, in BC and in the UK, people got a single dose of the vaccine, and now there's really very little disease in long-term care in Quebec and in BC. So we have a lot of data just showing that you get a first dose and those numbers just go down. The UK took the approach of getting the single dose into people as quickly as they can, and the case numbers dropped precipitously. They're now at about 50% of their population having had a first dose, and they're starting to lift restrictions now. I don't know about you, but I would love to have those restrictions lifted, right? So would everybody here, right? So this is a good strategy. It looks like this is a good strategy. We are also finding great data that excites me personally when I'm thinking about going to visit my mom. It's that single doses look like they're reducing transmission, right? There's studies of healthcare workers in the UK that seem to indicate that there is decreased risk, even after a first dose, of people transmitting the virus. Again, as I mentioned, you might be able to get the virus, but there's a decreased chance of transmitting it. So it looks like that strategy of get the first dose into as many people's arms as possible. That's the right strategy. It seems like it so far.
Thanks, Dr. Ihnat. So speaking of second doses, does the second dose have to be the same brand as the first one?
So that's a great question. And I should have prefaced, my remarks is that, you can probably tell that certainly because of things changing in terms of information that we're getting from our sources in government and in public health, we're constantly learning. We're constantly learning about this virus. We're constantly learning about vaccines. There's a lot of scientists that are putting, overtime into this. And so, this is also something we're learning about, right? The question of, can we mix vaccine brands? Do we have to keep the same vaccine for the second dose as you got in your first dose? And for now, we're saying yes. We're recommending that your second dose is the same as the first brand. The second brand is the same as the first brand, simply because that's how the studies were done. They were done with one brand of vaccine. But it's likely that we will find out in the future that a shot from one brand first and then from another brand second will be okay. In particular, you've heard about the various variants of concern around the world. So certain vaccines, we may learn, will maybe not be as effective against certain variants. And so right now, the variant of concern here in Ontario is the UK variant. It's the B117. And all the vaccines are effective against this. But that pattern may change in the future in Ontario. And when it does, there may be a decision that if just say one vaccine that you got for your first dose isn't effective against this new variant of concern that's coming on, maybe your second dose will be of a different vaccine. But we have to wait for the researchers to see. We really don't know yet. But right now, yes, same brand.
Awesome. So from a planning perspective, how will I know where and when to get my second dose? Particularly we're seeing for Thorncliffe and Flemington residents who have been getting their vaccines through pop-up clinics, either building to building or in our neighborhoods. They have not been given a date for a second dose. When they're going out to get their first dose, they're not being given a date for their second dose. Whereas people who are booking through the provincial website and get their vaccines at some of the mass immunization clinics, they are getting a date for the second dose at the same time when they book for the first dose. So since some of these Thorncliffe residents do not have a date for second dose, how will they be contacted? And how can we ensure that they're getting their second dose on time?
Yeah, for sure. Great question. And the short answer is, don't worry. We have your contact information, right? And so likely you'll be contacted somewhere around the 12-week mark to let you know when your next dose is going to be, where it's going to be. So the short answer is, yes, it's unfortunate that there are these kind of two different methods, but don't worry, we have your contact information, whether it's phone or email. You will be contacted, and yeah, there's very good tracking around the vaccines in Ontario, so you'll be contacted.
So I just have one more question for you before we pass it over to Dr. Syed and Amira. Can my family doctor give me the vaccine?
Sure, absolutely. The question is whether your family doctor will have vaccines to give you. The rollout in Ontario has been mostly focused on these mass immunization clinics or hospital-based immunization, pop-up clinics. So some family doctors do. I know that in the Toronto East neighborhood, there are some family doctors who have had the vaccine to give. I know that our clinic, on occasion, we got some extra vaccines from some other location that was giving out vaccines. But generally speaking, I think that family doctor is not where you'll have most of the vaccines given. In pharmacies around Ontario. But if your family doctor happens to call you and say, I've got some vaccine here to give you and you're eligible, take your family doctor up on it.
Brilliant, thank you.
Pleasure.
Thank you, Dr. Ihnat. So now we're going to move to Dr. Syed. And we're going to talk a little bit about sort of like what the vaccine is made of and specifically around Ramadan and the vaccine as well. So we'll start with our first question, Dr. Syed, is now that Ramadan has begun, can people still get their vaccine shots if they are fasting?
Bismillah, my name is Assalamu alaikum, and hello everybody. Thanks for joining us on a Sunday afternoon. So, this question is quite important. It's a good question to ask because as we know, or if we don't know, in Ramadan, from pre-dawn till dusk, we don't, people observing the fast don't eat and don't drink. Basically, nothing passes the oral cavity. So in terms of vaccinations, in terms of injections in general of any nature, most scholars and most theologians will say that anything that doesn't enter an orifice into the body is deemed acceptable. I mean, there's even ideas that IV nutrition in some circumstances is acceptable, though that's kind of contentious and there's some debate around that. So when you look at specifically vaccinations, there is no harm and there's no contraindication and there's no disallowance of taking a vaccine in a state of fasting, whether it's a COVID vaccination or any vaccination for that matter. Giving blood is also allowed, though it's not recommended because you're already fatigued and low in sugar, and giving blood in a state of fasting could induce more hypoglycemia, lowering of sugar in your body. But in terms of the vaccination, there's absolutely no concerns whatsoever in administering and receiving the vaccine. The theology is long, but I'll give the quick short answer.
Thank you for that. And then along that line, if you could tell us a little bit about what the vaccines are made of, and are the vaccines halal?
Okay. So once again, halal is a concept in Islam of what's permissible. And this applies to everything in life, whether it's clothing or appearance or relationships or anything we engage in, there's halal or haram aspects to it. And in terms of vaccinations and diet and eating, of course, there's things which are deemed halal and haram. So vaccinations are a very complex thing that people put together. There's lots of scientific research and lots of methodology and processes that are involved. Now, we have 4 different vaccines available, well, 3 at the mostly available to us right now. So of the 2, the first 2, the Pfizer and the Moderna, the mRNA vaccinations, there's really nothing. The product monograph is out there. There's absolutely nothing in there that would be contravening any rules of halal at all. I don't think I've come across anybody who said contrary to that. And then in terms of the AstraZeneca, there has been some conversation that people have had in terms of the fetal cell line. Now, fetal cell lines, for those who know and for those who don't know, basically, in a nutshell, these are cells that were gathered from aborted fetuses back in like the 60s, 70s, right? So these cells have been propagated, and that's where we get cell lines from. And these cells have been used to create and discover and to research many new medicines, vaccinations. In fact, the hepatitis vaccinations or chickenpox, and I believe rubella as well, they're vaccines that have come off of this cell line research. So it's interesting. I mean, this goes to show the interest that people have and the worldwide phenomenon around COVID, that I don't think I've ever been asked this question in regards to any vaccination, right? In fact, it's the opposite. I've suggested to people certain vaccines are better than others in terms of halal, but there's a caveat to that. Now, Islamically, and I'm sure we all know this, anything that you need to preserve life is acceptable, okay? So if there's something that somebody needs to heal or to preserve life or to get better, even if it contains ingredients which are by themselves not acceptable, it becomes acceptable. Off the top of my head, heparin is an example. I mean, we're talking about, Dr. Ihnat was talking about clots earlier, and heparin is something that we would use. Heparin, technically speaking, if you look at the ingredients, it wouldn't be allowed. But in the case of a medical necessity, it's 100% allowed, right? So vaccinations fall into the same rubric, same ideology, same thought pattern. So the AstraZeneca vaccine has been developed in line with research that's based on these aborted fetal cells from the 60s and 70s. The final product has nothing of this in there. There's absolutely nothing about a haram ingredient in the vaccination, right? But to be fair, there are some theologians who will indicate that because the beginning of it had a problem, then the end of it you cannot use, right? So to be fair, there are some people who would say, AstraZeneca in particular, they won't say it's not acceptable, they won't say it's haram, but they'll say that, you know what, there is some doubt to it. But the overall consensus across the board is that, the best, to echo again, Dr. Ihnat, the best vaccine for you is the one that's available to you in front of you. I mean, going back to this question has never been really asked, Hajj and Umrah, the people who go for the pilgrimage to Makkah and Medina. I mean, as a Muslim, this is something that many people, strive to and yearn for. Traditionally, there's been one vaccination available for this. It's called Menactra, right? Menactra is also part of the meningococcal for the children, as Dr. Ihnat will always say, right? In our public health vaccination schedule. Menactra, if you look at the ingredient list, has ingredients in there which would be considered not acceptable. But to go for Hajj or Umrah, you had to get the vaccination to prevent meningococcal illness. So up until about 6-7 years ago, everyone took it because you had to. But I don't think I had anyone ever ask me, what's in the vaccination? Now, in the past 6-7 years, we've had two other options have come up, Nimrix and Menveo, which actually their marketing campaign was your halal alternative, right? Because there was no ingredients that were questionable. So the question of, is it permissible? Is it halal? What's in there? It's a great question, but it's not a question that we should get stuck on because there is no issue. There's something, according to theologians, that we can take and we should use. And to tie into Ramadan, just a little, thought that I was having, in this month of fasting, in this month of trying to better ourselves through our struggles, we always remember the people around us. And in Islam, charity is huge. And one of the things of vaccines is that, yes, it'll help us, but it also provides protection to a degree of those around us. So if that's not reason enough to help others, then I don't know, right? That's a great reason, I think, just in of itself, if the health aspect is not enough. So bottom line, there's nothing in the vaccinations that are considered unacceptable from an Islamic perspective.
Dr. Syed, thank you so much for that. That was very clear and easy to understand. You kind of answered two of my questions. I'm going to put them in there anyways, just to have sort of the follow-up is, we have 4 different types of vaccines right now, but never have we had this opportunity to say, I want this vaccine when we're getting the flu shot or when we're getting our, so it's causing a lot of confusion. So if you could sort of talk about the similarities, and also that there is a myth out there that, Pfizer is the best vaccine to get. So maybe if you could just talk about sort of the similarities of the vaccines and how they work.
I mean, so there's 2 things to this, right? The first part in regards to we've never really had a choice for vaccination. I mean, we kind of have with the flu shot. We have multiple different flu shots that we give people, right? We have a flu shot, the quad, the one that we give to the elderly people, right? And then within the flu shots themselves, we have a couple of different versions that we are offered or given by public health. Then sometimes we have the nasal, the inhaled intranasal flu shot, right? So there are sometimes options that have been available, not to say that you could come in and say, I would like this or I would like that. But again, speaking of the halalness of it, I won't get into the flu shot, but there are flu shots that are more, if we talk about ingredient-wise, there are flu shots that are more appropriate ingredient-wise than other flu shots. So this is not unique to COVID vaccination. This is available with flu shots. And I know when we run flu clinics through different mosques here in the Peel region, when public health asks, which one would you like? And we discuss it, I always advise of what we have available, X or Y or Z is the best choice for this season. And then if you have this available, get this one, simply because of the ingredients. So there has some, choice available. Now, in terms of the vaccines, I mean, I won't get into the numbers and details because there's lots of data out there, right? Between these 4 that we have, lots of data, lots of numbers of efficacy and benefit and what it means in terms of protection for people. The bottom line, the one thing that we should always keep in our mind is, again, to echo everyone's thoughts, is the best vaccine for you is the one that's available to you, right? That has to be our underlying principle. Because if we wait around saying, okay, I want that or this or the other, who knows? Now, interestingly enough, just the other day I was reading about Pfizer. And yeah, there's people who say there's a rumor out or the thought is out there it's the best and the greatest to get. Not necessarily, right? Not necessarily, because these vaccines work in very similar ways. We have the mRNA based and the ones that are using a viral vector. But the end result is to teach our body that when we are presented with this pathogen, this thing that's attacking us, right, this virus, it's to prepare our bodies to react and to mount a defense to it in a quick manner. And again, the goal of the vaccine isn't to say you won't get sick. It's to lessen the chances of getting sick. And if someone does get sick, it's to make a prevention of a serious illness. The idea is to keep people away from the hospitals. As we see, I mean, we're not seeing it as much in the media, but if in the medical world, if you discuss with our colleagues in the hospitals and in the networks, the hospitals are struggling. We're at our backs are against the wall. So these vaccines, they all work in similar ways, but the goal of them is to protect our bodies, to prepare our bodies, to protect ourselves when we are actually faced by the illness. I'm not sure if I'm really answering the question, but it's the best way to answer it without getting into details and numbers and statistics about what's the best vaccine and which one works the best. What I was starting to say a moment ago was that though Pfizer came out first, there are some reports that are actually showing that AstraZeneca may be the front runner in terms of these variants, right? That, I mean, who knows? Everything is so new. This virus came out just over a year ago. And a year later, here we are trying to figure out how to manage our way through this maze. So yeah, these vaccines all work together in a similar, all work in a similar manner, but the end goal is to prepare our bodies.
And you did it again, Dr. Syed. You just rolled right into my next question was, when we are looking at the variants of concerns, how do we know if these vaccine options that we have will cover the different strains or variants of concern?
So, maybe I'm just good at segues. Maybe that's what it is. That's why I keep leading into the next question, right? So some of the data that we have, actually, some of the best data is coming out of Israel. And they've done a phenomenal job in vaccinating the population, right? And a lot of our data is coming from there. So, and some also from the UK. So we've been able to see that the vaccine has showed some good results and good promise in terms of these variants of concerns, right? In particular, in terms of the UK variant. Now, with this new variant that's coming out, the double-stranded mutation that's been we're seeing now. Well, it's in Ontario. It's been a while, but now we're sequencing it, and we found a few dozen cases in the past few days. That's still, I haven't really come across much data in terms of how our vaccines are providing benefit or protection against these VOCs, the variants of concern. But to date, what we do have from the populations around the world who've been quite aggressive and quite successful in getting the majority of their population vaccinated is that the vaccines are working even with the variants of concern. They're working towards mitigating the illness that people get and keeping people's illness level to something that's manageable in the community, right? Not to say getting sick is okay, but I'd rather myself get ill and be at home as opposed to being so sick to have to go to hospital. So the vaccines are showing some promise and some benefit with these variants of concerns that we've been able to see to date.
Perfect. Thank you, Dr. Syed. I'm going to pass it back to Iman, but I just want to make one quick note. If you have questions, I please encourage you to use our question and answer box. That way our panels can answer live, or we can make sure that we capture it. We want to make sure that we're capturing everyone's questions. So I encourage you to please use the question and answer box. Thank you. Iman, it's all yours.
Thanks, Amira. So Dr. Ihnat, my next set of questions are around children, youth, and families. We're hearing that a lot of pregnant women are making it to hospitals with COVID-19. And you touched upon this briefly, about vaccine safety for women who are pregnant, breastfeeding, or on birth control. Would you want to elaborate a little bit more on this? In terms of vaccine safety for these women, and are there any plans to prioritize pregnant women to get their vaccines at a mall clinic, through booked appointments, particularly as they cannot be expected to stand in long lineups when we have some of the pop-up style clinics?
Again, a great question, very important question. There are a few things, more that I am concerned about more when I think about, patient populations. It's pregnant women, breastfeeding women, and ensuring that pregnant women want to do obviously what is best not only for themselves but for their baby, and of course we want to be very, very careful about that situation. So the first thing I want to just start with a summary and to say that it's good news. It's that the vaccines actually appear to be safe in pregnancy. In fact, the Society of Obstetricians and Gynecologists of Canada have supported the idea of using all available COVID vaccines, including AstraZeneca, all of the available vaccines in any trimester of pregnancy, and also during breastfeeding. And that's of course in accordance with the regional availability and eligibility, et cetera. But yes, and in fact, they emphasize, the Society of Obstetricians and Gynecologists of Canada emphasize in their statement that essentially the risks of being pregnant and getting COVID are so much more than the risk that apparently there isn't even any evidence of any concern with the vaccines in pregnancy. So they do recommend that it be offered to pregnant women. So let's talk about some of the evidence that we do have. There was a recent study in the USA. This is published in the New England Journal of Medicine, that they looked at, I think it's something like 40,000 pregnant women, and then they followed about 4,000 of them who got the vaccine, and there was no signal of concern. There was no what we call a signal, an indication that there is any adverse outcomes. So that's reassuring. We know from our history of giving other vaccines that other non-live vaccines are given to pregnant women regularly. And they're not only safe, but they're positively good. Like we want to give them to pregnant women. We want pregnant women to get these other vaccines. So from our experience, we encourage pregnant women to get the flu shot all the time, for instance. And we know that this is protective. And so this kind of, first of all, the emerging data, so the theory, first of all, of the vaccines wouldn't indicate that there would be a problem. The emerging actual data from pregnant women who have gotten the vaccines do not show any signal of a problem. The experience we have with other vaccines don't show that there would be any problem, not live vaccines. And then we get to the point of what's the current situation with pregnant women and COVID? Well, it turns out that pregnant women are in the highest risk group for bad outcomes, bad complications from getting coronavirus, COVID-19 during pregnancy. A pregnant woman may think, I'm young, I have no health conditions, I should be fine. But pregnant women are already, we know in medicine, we know that they are already more susceptible to respiratory infections. So they're at increased risk of getting COVID. And we have found, now we have experience now, you've probably heard about it on the news, that pregnant women are at increased risk for hospitalization, intensive care unit admission, mechanical ventilation, that's a tube down your throat again, and death compared to non-pregnant individuals. So after getting COVID-19, approximately 1 in 10 pregnant women will require hospital admission. And 1 in 100 pregnant women will require intensive care unit. So right now, about 20% of the occupants of the intensive care unit at Mount Sinai Hospital are pregnant women. So this is a serious problem. And for some individuals, for some pregnant women who have other risk factors such as advanced maternal age, obesity, pre-existing conditions, the risk of morbidity problems coming from getting the virus are substantially higher. And it's not just the respiratory problems. It's not just the fact that the mother would get, the pregnant woman would get COVID and have bad outcomes from COVID, worse than a woman who is not pregnant. But it's also the potential impacts on the unborn child, because we know that with COVID, it actually increases the risk of preterm birth, which has significant consequences for the baby. So, those are all the bad things that you want to avoid, but even vaccination provides one good thing we're starting to see, and that is that it may help. The vaccination may help your baby by transferring the antibodies that you make in response to the vaccine to the baby, just like with the other vaccines. And we're happy about that, right? We want that. So, this is now becoming a consensus that, vaccination, if you're pregnant, is recommended. Certainly if you want to clarify things, I always encourage having a good conversation with your family doctor, with your nurse practitioner, with your midwife, whoever you're engaged with for your obstetrical care. Certainly, that's very good. But I'm talking in generalities that this is what we're seeing, and the risk benefit analysis seems very clear. So in response to the question, are there going to be any special focuses on pregnant women in the future? Absolutely. In fact, I can tell you about one coming up. So this Thursday, April 29th, we're having a vaccine clinic specifically focusing on pregnant women. And by the way, this is in any stage of your pregnancy: first trimester, second trimester, third trimester. Thinking about pregnancy, get the vaccine if there's no contraindications. And this Thursday, April 29th, from 9 a.m. till noon at the Hub, I believe. My colleagues Amira, Munira, and Iman, you can probably confirm this. And I believe that is booked. These are booked appointments. That's my suspicion. So, thinking about the standing in line, I totally agree. I don't like standing in line myself. Pregnancy, no, I wouldn't want to do that. So absolutely, I believe that's taken into consideration. And just to finish off, breastfeeding, no contraindication to the vaccines. Women on birth control, no contraindications to the vaccines.
Thanks, Dr. Ihnat. That's very, very helpful.
Thank you so much, Dr. Ihnat. We're going to go over to Dr. Syed because we do really want to get to some of our live Q&As. So I'm going to actually group these together, if that's okay. And that is, can I still, if we're just talking about sort of immunity in this section, is can I still spread COVID if I've gotten the vaccine? Do we still need to continue to wear masks if I've gotten the vaccine? And then the last one is, can I travel if I've gotten the vaccine?
Okay. So, once again, these are great questions, and these are things that we're all hoping to get back to soon, right? Living life and going out, and for me personally, getting ice cream, right? Hanging out. So these are things that we want to get back to as soon as possible. So the question is, what will these vaccines do for us? So as we've all been discussing, the vaccines are looking to reduce illness, right? It doesn't mean that we won't get sick. The chance of getting sick will be less, but then if someone does get unwell, it hopefully won't be as severe, right? And there's some studies that are showing up to 100% of that if someone does get COVID after the fact, it will keep them out of hospital, right? So no, the vaccine isn't a it's not a silver bullet that now I've got the vaccine and that's it, I will never get COVID. That's not the case. The case is that we are less likely to get sick. And if we do get sick, we won't get as sick, right? So the question in particular, can I spread it? Again, the data is changing, the data is evolving, but we still have to maintain our due diligence, right? I know there's places in the States, I believe, where the CDC has now recommended if people have had both shots, both vaccines, they're double dose, they're allowed to meet with other people who've had double dose in certain circumstances, right? So again, that's an evolving area. And it's something that the goal is to be able to live life normally. But again, just because we got the vaccination doesn't mean we can't spread it to others. We could be carriers who just aren't sick enough to show anything, but we may give it to somebody else in the community who isn't able to fight off or isn't able to, mount an immune response the way somebody else would. So yes, we will have better chances with the vaccination, but we still have to maintain our safety protocols and be aware that we could be carriers, asymptomatic carriers of it. The second part of the question, I think, was, do we still have to wear gloves and masks? Again, that ties into the same thing. For the short term, yes. Until we have a certain amount of immunity, herd immunity, so as we call it, and until we have a certain number of the population that's immune or been vaccinated, and we see that people aren't getting as sick, and we see the numbers are dropping. Up until then, this is, as I tell my patients all the time, this is the new norm, right? Masks and hand washing. Well, hand washing we should be doing anyway, right? But masks and hand washing and distancing, with or without the vaccination, doesn't change at the moment. So the third part of the question, I lost it. I had it written down.
That's okay. It was about, yeah, it was just about, can I travel once I get my vaccine?
Oh yeah, again, so the travel aspect is still, so just the other day, a few of us penned an open letter and we posted it on change.org, and it was about travel. I mean, we won't get into the politics of it, but to be honest with you, travel is something, I'll put it out there, we shouldn't be traveling at all, right? Until we have a good grasp on and a good grip on what's happening. I mean, anecdotally, I'll just give a quick example of the many patients that we've seen. One patient in particular, they traveled to India about 2 months ago because the understanding was that India had defeated COVID, right? That the general understanding there was that we were COVID free. Unfortunately, we see that wasn't the reality. So the person while there got COVID, they tested positive, very mild illness, and then they got better, and then they were able to come back to Canada. 3 days after getting back home, they started feeling very unwell. So their illness was about 4 weeks ago. Now they've tested positive for likely the variant from India, right? And now it's in the whole house, the family that they're living together, and they've all gotten unwell. So this is about travel. So travel is at the moment, absolutely not. Vaccine or not, I have to look at the data again, but travel is not something that's in the foreseeable future, at least.
Okay, great. Thank you, Dr. Syed. Thank you again to both our wonderful physicians for answering our pre-submitted questions. We have a little bit to live questions. So either of you could answer. The first question is, with the vaccines and knowing that, we're waiting the 4 months in between, the question is about a booster and what does that look like? Whether we've get the first one now and the time is elapsed, do we need to get another shot? So what does that look like? Would we need to get a booster every 6 months, every year? And either of you could answer, that would be great.
So I'll jump in because Dr. Ihnat is being quiet. So, I believe it was 2 weeks ago that the Pfizer CEO, or 3 weeks ago, indicated that there would be a booster, likely. And the way I envision it is eventually we may come into a routine where I think this may be the case, that this may become like the flu, right? Where every year we have to get a shot. Which is a good thing because it teaches us, like any other vaccination, hopefully we'll come to a point where this will become another part of our protective mechanisms that we get shots for. So yeah, it is a moving target, but I wouldn't be surprised to see that we need a booster. I mean, we have to keep in mind that this like people sometimes, this is off the question, but I just want to throw this in there too. There's been some people who've asked, how could we have developed something so quickly, so rapidly? It's unprecedented. It's not, well, no, getting to the moon was a worldwide affair. People got together, created a shuttle, and did something incredible. It was a world effort. That's what happened with this COVID vaccination. It was a world effort. All across the world, people shared data, scientists, researchers, and worked diligently. Maybe somebody else can say they have. I've never seen a situation, nor do I recall a situation where worldwide everyone got on the same platform and said, hey, listen, let's get to work. Forget politics and government. Now it's different, but initially trying to figure out how to get this vaccine out there. So everything is evolving and changing. And in the same way, I think I feel that, yeah, we will likely need a booster, but it's not ingrained in stone and we don't know clearly yet. And from Dr. Ihnat's nodding, I think he would echo.
Totally agree. Yeah, that's what I've heard. Again, I'm not a virologist, I'm not an immunologist, but what I've heard is that this will probably be like the flu. And as you just said, that we're gonna, especially as variants are coming up, right? And we need, the flu has variants, right? And we need to adjust our flu vaccine every year, depending on which variants of the flu are going to be more prevalent in Canada and North America, based on what we see happening in other continents before the flu gets to us. We're probably going to need this kind of global surveillance of COVID-19 variants and adjusting, vaccinations as such. But hopefully it'll be something like the flu shot that we don't really need to think too much about, and we just get it every year, and then we enjoy our outside and our outdoors and our friends and our family.
Perfect. Thank you so much, Dr. Ihnat. So we did have a question that came through our chat box. We had a couple questions actually. And I know that Dr. Ihnat had responded, but I don't know that you've all had a chance to read the response. So I'm just going to read it out. So once numbers get under control, we think the government should incentivize getting a vaccine by opening more activities, people who get vaccines, even one dose after a 2-week period. And so Dr. John wrote a great answer saying, hi, interesting data about incentivizing. As for children at the moment, the vaccines are not available for children. Things may be changing soon as we get more data. So I apologize. The question was, I have a 4-year-old and an 8-year-old. What is the status of vaccines for that age group? So thank you so much for that. And then we've got another question here. I'm scared of standing in any long lineups for the vaccine with COVID being so widespread. I would prefer to get my vaccine at a place where no long lineups, so I have less exposure to people. Is that a reasonable thought process? And again, our lovely answers are, the short answer is vaccine centers are very concerned about infection control, staying 2 meters apart, wearing a mask, and transmission is unlikely. I would encourage everyone to get the vaccine where it's offered. And thank you for your questions. Again, if you have some questions, please put them in the question and answer. I do believe we have a few coming in. So I have got one here. Again, if either physician could answer, that would be great. And we just kind of sort of talked about it, but what are the plans to vaccinate kids? Pfizer is doing trials for 12 and up and Moderna for 6 months and up. Would want to be proper schooling so that we could go back to schooling in September. So I think we sort of talked about that, but if there's any added pieces that either of you wanted to add in about that. No? Okay, I'm getting some nods. So I think right now
the studies weren't done in children, and so we just studies will continue to be done, and as that data rolls in, we'll find out more. Maybe it was because earlier on, I don't know whether I'm remembering correctly, but I think that children had less poor outcomes, in the early stages of COVID. So maybe they just weren't a priority at that time, considering. But again, that's speculation. I don't know. But we'll probably get more information coming up, and we might be able to offer that to children as well.
Perfect. Thank you so much. And our next question is, and we've sort of addressed this already, but I'll just read it out and maybe we can reiterate the information. But with the 4-month gap in limited vaccine supply for the next few months, would folks who got first dose get priority to get the second dose within the 4 months over the folks who've not yet received their first dose? So Dr. Syed or Dr. Ihnat, either.
Okay, so I'll just, so in terms of the vaccination, Dr. Ihnat had actually commented at the onset that our supply chain is increasing, right? That we're getting more and more doses of vaccine coming in. My second dose, for example, literally a few days before it was to be, given, got bumped, right? So it's the best decision to make to get as many people vaccinated, right? The idea is instead of having a small subset of people with double shot, get a large group of people with a single shot, because we know the single shot is very effective, whichever vaccination we get. So, I wouldn't get too stuck on the timing of it, So as we get more vaccines, the timing will change, and it'll be based on when you got yours, right? So I mean, maybe I'm hedging on that question. But really, maybe Dr. Anna has something more to offer, but I wouldn't get stuck on the idea of who gets it first in terms of when it comes. I mean, as we were talking about, we have a great software that's tracking COVAX, right? So it's tracking everyone who's gotten it, when you're supposed to get it. And in terms of the further follow, I think there was a question earlier about the follow-up and when do we get our second shots. So everything is there. Big Brother knows about who got what. No, it's coming, so don't worry.
Perfect. Thank you, Dr. Syed.
Yeah, I totally agree with what you said. Maybe the metaphor is something like, it's better for everybody to have a good meal than for some people to have a huge banquet, and then and then for some people to have nothing. So yeah, it's that. I don't know whether that's the right metaphor, but that's the idea. Is that
we're fasting is a great metaphor.
let's get that first shot into as many people as possible. Yeah.
Awesome. So we're going to actually give our physicians a little bit of a break because we've asked them a lot of questions, and we're actually going to open up the floor to our lovely community health ambassador, Raha, who's going to share a little bit about sort of her experience. So Raha, I'm going to ask if you could actually share your experience as a community health ambassador, and why did you feel it was important to get involved in your community?
Thank you, Amira, for asking that. It's been lovely hearing the doctors as well share all their experience. I'll just start off by saying that I'm very grateful to be able to support Thorncliffe Park and Flemington Park community as a community health ambassador. In terms of my experience last year, we began by sharing information about COVID testing sites, answering questions and concerns that the community has. And now we've been spreading news about the pop-up clinics as they continue to be scheduled and out in the community. So all the flyers you see in your buildings and the local businesses, that's some of the behind the scenes information sharing that we've been doing. For me in particular, it's been really enriching in the sense that I have been part of community work that has made access to resources easier for us residents to reach and to access. I specifically have been able to help out at 2 pop-up clinics so far. And I think to last week's pop-up clinic and how an older gentleman came up to me not knowing how to book an appointment through a pharmacy. So I was able to talk him through it until he understood the process, and he left able to access the vaccine through a pharmacy since the pop-up clinic was booked for that day. And just his sense of relief really impacted me and reminded me how meaningful this work is during this time in particular. And then you also asked me why it was important for me to get involved. So I've lived in Thorncliffe Park for 10 years now, and I've witnessed how challenging it is for some families and folks, including my own, to navigate the overwhelming amount of information that has been coming their way about COVID-19. And it's been important for me to help share supportive messaging about getting tested, about getting vaccinated, and about getting connected with the resources that families and folks need. For me, as well as a public health student in particular, I'm interested in improving the health of my community. So it was also really important to go beyond just classroom learning to support community work that is making an impact on the lives of people I know, people I live and work with and gather with as well.
Amazing. Thank you so much. And so I'm going to go back to one thing. So you shared that you've been at 2 pop-ups. So to help folks understand sort of what is the process when someone goes to the pop-up, what does that look like? So if I'm a resident and I've made a decision, I'm going to the next pop-up and I'm going to get my vaccine, what should I expect?
Yeah, I can definitely walk you through that, Amira, and to our listeners as well. So when you arrive at the pop-up clinic location, you'll get in line. If it's a bit confusing, if you first arrive, you will see some of the community ambassadors in like nice yellow pennies will be able to direct you to where the line starts, where to go. The staff and community health ambassadors, again, will chat with you if you have any questions at all. Once you're in line, a designated staff member will give you a vaccine card, which is great. And it means that you are confirmed to get a dose at that vaccine clinic on that day. Another staff member will get you registered with your photo identification and proof of address. You'll also give them your contact information. That's been mentioned before, so that contact information will be able to, sorry, so you'll give them your contact information so that you will get notified, there we go, that whenever your second dose is going to be. So once you're at the front of that line, you'll have a seat at one of the nurses' stations, one of the vaccine administrator stations. They'll give you your first dose, and then you'll move to another area and wait about 15 minutes. So that's the process for that. And I also know a lot of people have been wondering when more pop-up clinics are coming. And as we hear from our partners and schedule more vaccine pop-up clinics, we'll share this information as quickly as possible with our networks. We're here to mobilize for you all, our team, just to get the information out as quickly as we can, as soon as we know when the next clinics are confirmed through word of mouth, emails, flyers. And I'll just let Amira maybe also add anything else about those pop-ups, or any of the other panelists.
Thank you, Raha. You know what? You did a great job. I'm actually going to pass it over to Munira, who's going to give you all that great information. But thank you so much for sharing your experience.
Thank you.
And Raha's just speaking to your incredible work. Yesterday at the vaccine clinic, there were 3,000 doses administered in the pop-up held at the community hub in Thorncliffe Park. So far as I know, that is the largest number of doses that's been administered in one day in one site. And so once again, this is a big thank you to all of our community ambassadors in TNO, in Flemington Health Center, and at Health Access Thorncliffe Park for sharing that information, for sending flyers out. Whenever we ask people in the line, how'd you find out about that information? It was through flyers that were dropped in their mailboxes, that were shared in their lobbies, in their elevators. So without you, this important work could not happen. And so it's a thank you from all of us at the organizations and from the community for the tremendous, tremendous work that you all have been doing throughout this entire year. So thank you for that. I'd like to just address one thing. We've had a few concerns that have come up around the pop-up clinics and the vaccine prioritization for Thorncliffe Park. I just want to say on here, we don't have the answers to that now, but we will pass on those concerns around, number one, prioritizing the second dose of the vaccine, and also around the setup for pop-up clinics in the buildings. We will basically pass that on back to the vaccine rollout planning table, and we will get back to the community with that information. We want to encourage all of you to continue to share any questions, any concerns you have with us. This is what this forum is for, and not just from one forum to the next, but we're all available you have our contact information through email. Let us know whatever your questions or concerns are. We're here to answer. If we don't have the answers, we will find out for you and we will get back to you. We want to ensure that all of your doubts and concerns are addressed. While we are kind of in this middle space between testing and in this hopeful place of all of us getting vaccinated, we do know that as a community, we continue to be affected by COVID. So I'd like to let everybody know there are resources available for the community as they need. So I'm just going to share my screen here. First of all, is the community hotline. This is a number that you can call if you have tested positive and you are homebound and you need any kind of access to groceries, if you need access to any kind of resources, any supports around rent, for example, or if you have lost income because you need to stay home, then calling this number gives you access to our joint services across TNO, Flemington Health Center, and Health Access Thorncliffe Park. We're here to help any way we can. So please call this number and we'll be here to help you. This number is also the number that can be called if you want to book an appointment for testing, and as well as for vaccination as well. It's all one number. I do appreciate that in the past couple of weeks, we were basically inundated with calls and we couldn't keep up. So there was a bit of a wait time. I exhort all of you to just please be patient with the holding time. We're working on the back end to alleviate that wait time. So those are the two, sorry. And just as we close up for the evening, I would like to ask all of our panelists, Dr. John, I'd like to start with you on what kind of, like, any closing comments you have on what we should take away from today's forum and what can we be hopeful for in the next little while.
Sure. Thank you very much. First of all, again, gratitude for this event. But to say, what to take away, one of the things is, I kind of want to speak to everybody who's listening out there, and to say, if nobody's thanked you for being patient and understanding with all the changing information as the knowledge develops and as the science develops, it's been hard. I know it's been hard for everybody to kind of see the information changing from day to day. And so, I don't know who I'm speaking on behalf of, but thank you for being patient with how this is rolling out. We don't have a lot of the information. We're still learning so much. I should have said, with the pregnant women, we don't have the benefit of seeing the child at age 5 now after the mother has gotten the vaccine. We don't have that benefit. What we have to do, though, is we have to look at the risks and the benefits now. And I would urge you to balance those risks for yourself. Think about what we've said today. Think about those risks, and I hope that you will consider getting this vaccine, because really it's such an important element in our fight against having our loved ones, our family members, our friends, our community members, our elderly members of the community suffering and dying from this terrible illness. So please do to consider getting the vaccine. But it is only one of our weapons in the fight. I'm very interested in questions of equity, and I'd like to say that as a society, I think maybe one thing that makes me hopeful, Munira, when you ask that question, what makes me hopeful is the advocacy that's happening now around the social determinants of people getting COVID. I'm thinking about the advocacy for paid sick days that's happening. People who are in essential work are often the most at risk right now of getting the coronavirus. And they're at highest risk, because they're encountering other people. And so some people have to make this decision of, I'm feeling sick today. Do I go to work being sick and maybe infect other people, or do I stay at home and maybe not be able to pay rent? Nobody should be having to make that decision. So I really encourage people, if you're supportive, to get involved with the advocacy for essentially things like paid sick days and supporting people in our society that may not have the resources or the ability to support themselves. So that's what I'll leave with. But again, I'm hopeful that we'll all be able to do this kind of thing in the future in person and see each other's faces in 3 dimensions. And again, all the best to everybody. Be well and stay safe.
Thank you, Dr. Ihnat. Dr. Syed, we'd love to hear your closing remarks for today.
I mean, Dr. Ihnat summarized everything quite well. Thank you for putting this together. It's definitely a conversation, that needs to happen often and again. My kids were asking me earlier today, they were saying, you're off today, but you're not, because you're doing something, right? And it's important that we all do this. And the conversations are evolving and people are benefiting, and it's important. And actually, the great point that Dr. Ihnat made, and I apologize if I'm mispronouncing your name, is that this circumstance, this thing that we're living through, has really opened the eyes of a lot of people in community and society of who are truly in need of help, just generally speaking, right? And who gets on, who has the higher likelihood of getting sick and then not being able to do anything about it, being stuck, right? So the hope is that this will be a springboard once we get past COVID, because we will get past this. It's just something we're struggling with, but we'll get through it, right? That when we get through it, then eventually we'll be at a point that we actually can look and see, okay, well, we had this event and so many people got affected and others didn't. Why? Right? These are the social determinants of health that we were just alluding to. So this hopefully will be a springboard for us to work towards equalizing and providing care and benefit to those who actually need it the most. I mean, when I get people who come in and I'm reviewing their blood work or whatever the case may be, and everything is looking great, I actually thank them because their good health makes my job easy, right? So people taking care of each other and being healthy, and for now, just stay healthy. And it's difficult. We've been locked up and quarantined and Peel. We've been in lockdown for I don't even know when we started lockdown. It's just this been long rolling lockdown in Toronto as well. But there's an end to everything, and it's a process, and we're getting through that process. So just like everybody else here, I'm also hopeful that we'll get to the end quick and be outside and about with our families and our loved ones and meet everyone around us and know that we got through this and if how to manage and take care of each other from this. So thank you guys. Stay healthy, stay safe, and take care of everyone around you.
Thank you, Dr. Syed. So with that, just a reminder to everyone, keep your masks on. Make sure when you go out, keep your distance. Get tested if you have any symptoms, or and stay home if you or anyone at home has symptoms of COVID. We're here to help. Keep your questions coming, and we will see you next month. This forum is held on the last Sunday of every month in the afternoon. Thank you very much to all of you for joining us today on this Sunday afternoon. Have a wonderful evening. Assalamu alaikum.
Bye-bye, everyone. Have a wonderful evening. We'll see you in a month.
Bye, everyone. Have a good evening.
Good night, guys. Thank you. Bye-bye.
Bye-bye.
Bye, everyone. Thank you.
Thank you. Have a good evening.
Bye-bye, you too.